Hello everyone, welcome to the lab. We were going to be filming a Achilles tendon video today, but we changed our minds because of what's going on with coronavirus. And so we want to give some information on that. Some of it will be a review and some information you've probably already heard about. But one of the things we wanted to do a little bit differently is give you guys an idea about what it's like on the other side for the healthcare providers. I've been at the clinics the last few days and there's been a lot of talk about this. How are we going to manage it? What are our protocols? And to be quite honest, the protocols are constantly changing based on the number of cases in a given state or a given area. And so we're constantly getting updates and having discussions about how we want to manage this on our end. So first of all, I want to just mention it is March 7th, 2020. That's when we're posting this video or when this video is being filmed. And so just be aware that this could change on March 8th. I could be finished filming this video and some of the protocols could change when I go check my phone. So let's just quickly review what coronaviruses are or what's going on with that. There's a lot of different strains of coronaviruses. And some of these are mild, some of these are more severe, but the ones we're talking about now are described with these acronyms that you've probably heard: SARS-CoV-2 or COVID-19. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. That's the specific strain of coronavirus that we're talking about, and that causes COVID-19, which stands for Coronavirus Disease 19. So it's a specific type of disease, and 19 refers to 2019. So how is this thing transmitted or transferred from one person to the other? And you'll probably hear phrases like respiratory droplets. And these respiratory droplets are in respiratory secretions that can get out through sneezing, coughing, if you're close enough to a person, possibly even through breathing. And we talk about, okay, so if you get this spread from one person to another, how long does it take for somebody to have symptoms if, say, that respiratory droplet had the virus from another infected person? Now, you'll hear 14 days a lot of the time. In a lot of the literature and a lot of probably the news reels that you've seen or YouTube videos, they talk 14 days because the incubation period in some cases could take up to 14 days, meaning the day you get the virus in your system to the day you actually have symptoms. Most people don't get it in 14 days. They'll actually have symptoms within as soon as 5 days, sometimes even sooner than that, in 3 or 4 days. And so that's what we talk about, the incubation period. But typically, if you get past that 14-day window and no symptoms, that's when you're talking about being in the clear, if you will. So say you are a person that were to contract coronavirus and you get exposed to it. 5 days later, you experience symptoms. What are those symptoms? Well, in the screening process, we like to talk about with people, well, do you have a fever? Are you coughing? Do you have shortness of breath, also referred to as dyspnea? Do you have body aches? Sometimes people call those myalgias. And as the illness is more severe, people can sometimes develop pneumonia, and you'll see things show up on chest x-rays. Now, the interesting thing about this virus is, according to the World Health Organization, 80% of the cases are referred to as mild, meaning most people are going to clear this infection on their own with supportive therapies. So what are supportive therapies? Supportive therapies are essentially things that you do when you're sick to make yourself feel better. So for example, if you had a cold, you've probably taken Tylenol, ibuprofen, drank fluids, probably tried vitamin C, other home remedies like salt water gargles or humidified air, and even cough drops or throat lozenges. Those are things that, again, just make you feel better while your immune system's actually doing most of the work. And that is the case with this coronavirus. The immune system is going to ultimately have to kill and deal with this virus on its own. And you can do things to, again, make yourself feel better during this, but again, immune system is going to take over. So what's going on with the other 20%? Well, obviously these patients are getting more of a severe case of the illness, where we're worried about severe pneumonia or getting into critical situations where they have respiratory failure and even sepsis. And that's where the healthcare teams are kind of coming in. One of the things that we're trying to do is assess that. And one of the challenges is of how do we assess that without exposing other patients to potential coronavirus, other healthcare workers to coronavirus, and make sure the patients still get the care that they need. So one of the challenges for me as a healthcare provider and even my coworkers is this ever-evolving changes in protocol on how we're doing this. And we get a lot of questions from patients all the time about testing. How do I get tested for coronavirus? Who should be tested for coronavirus? And frankly, where I'm located right now, there's not a lot of testing capabilities. And so the local health department is essentially limiting testing to only patients that meet certain criteria. That's as of today. That could change tomorrow or the next day based on how many tests are available. So we've gone through a couple of different screening processes. The ideal situation is that a patient calls into our clinic and talks to us or gets kind of a televisit or a virtual care visit where they can go through their symptoms with a potential provider to say, okay, this is what you need to do. You need to come in so you can be seen, or you can actually stay home based on the symptoms you have, and we can call you in the next 1 to 2 days to see how you're doing. So what are these testing criteria? Well, first of all, as of right now, no health department is going to test somebody who has no symptoms. So people who are just worried and well, sorry, we've got to reserve that for people who are actually having some of these symptoms and meet some of the following criteria. Now, these are kind of my local criteria from my local health department. They might vary slightly based on where you live, but one of the first criteria is essentially a fever and lower respiratory tract symptoms, which would include cough or potentially shortness of breath. Those symptoms combined with contact or close contact with somebody who has a confirmed case of COVID-19 within the last 14 days. So criteria 2 has some differences than criteria 1. Criteria 2 still would include fever, cough, or shortness of breath, but also then combining it with, okay, if this person hasn't had close contact with somebody who has a confirmed COVID-19 case, have they traveled somewhere where COVID-19 is in this outbreak? Like, have they recently been to China in the past 14 days, or Iran, or Japan, or some of those countries that you've heard about? But with this criteria, you also have to fulfill one other thing. Can we rule out something else? Like, is it flu or just an upper respiratory tract infection? So the third criteria kind of throws out those risk factors of, have you been in contact with someone who has a confirmed case of COVID-19? And it also throws out, have you been to a country in the last 14 days that has an outbreak? And just solely focuses on a patient that has fever, shortness of breath, and they actually have more of a severe disease like pneumonia or acute respiratory distress syndrome. Those patients, they're starting to think, okay, we might just start testing them anyway. And that recently changed because there was an actual confirmed case in my local area, and so they've actually made that available. Now we might be having this spread through the community. So if you're a person that lives in an area where there's been a confirmed case of COVID-19, don't freak out, especially if you don't have symptoms. We're encouraging people to not take up the phone lines or take the time out of other healthcare providers to just get information about testing or be like, can I be tested and I have no symptoms? That literally is going to take time from another patient that actually needs help, that actually does have symptoms. So hopefully people who are watching these videos or things online or on the news are essentially saying, okay, I'm okay, I don't need to call unless I get symptoms. If you do have symptoms like a fever and cough, we encourage people to actually get on the phone with a healthcare provider. And at least at our clinics, we'll go through some of those clinical and testing criteria and decide, can this person stay home? And if that person can stay home, that obviously means they have a mild illness. It can't necessarily be confirmed as coronavirus, obviously. But if it's not severe enough, we're not going to have them come in and get tested. We will recommend home isolation. Now, isolation can sound like a strong word, but we're talking about isolating you in your comfort of your own home and not exposing other people to the illness. And we'll even, at least our clinics are even talking about in calling patients 1 to 2 days later to make sure that their symptoms aren't getting worse. And if the symptoms aren't getting worse and they're even getting better, that patient can continue to manage with supportive therapies at home. So what if you are a patient that does need to be evaluated at the clinic? Well, we've had situations where we've encouraged patients to let us know when they get there, so we establish communication with them. We've had patients get swabbed in their car and tested in their car so they don't actually expose other patients in the clinic to whatever they have, whether it's coronavirus or suspected coronavirus. And if we have to actually bring the patient into the clinic, we've had dedicated rooms with HEPA filters, which are kind of filtration systems. And we also have these N95 masks that people have probably talked about. You see people in gowns and even cappers, which are these cool little helmets. I think they're cool little Darth Vader helmets that essentially protect the clinician to actually get specimens and swabs and to protect the clinics around you. So I think there's this fear and there's this concern and this idea of like, you hear these words about isolation and kind of this taboo of like, oh no, this person has coronavirus. But I think I want people to know that yes, we have to protect the healthcare providers and they're going to wear masks and they're going to wear things. But people go into healthcare because they want to help people. We're setting up all these protocols so people can get the care that they need and people can get directed to where they need to be so we don't overload the system and people who need to go to the hospital get to the hospital. People who get into the clinic and get evaluated in the clinic can still go home under, isolation protocols. And people who don't need to come into the clinic can actually stay home and manage at home and have close communication with their local clinic if things change. So hopefully that gives you guys some information about kind of the healthcare perspective, what's going on our end. There's more information that I could have gone into detail, but we didn't want to make this a long, drawn-out video. We just wanted to kind of give initial helpful information that can, one, maybe hopefully calm some nerves and give information about how to manage this. It's going to change. We're probably going to get more tests available, more testing capabilities, and the testing protocol is going to change. But it's kind of an interesting, from a cheesy philosophical perspective, to see how, how we all kind of are connected in this and how we all do need to do our part to control this and actually make sure that we're doing the right things as a society to make sure people get the care they need and also not create unwanted or unnecessary fears around this. So if you guys have questions or comments or any useful information that you've seen, go ahead and post it below, and we'll definitely see you guys next time.